One of the most important steps in the gowning procedure is conducting a self-check. It is imperative that compounding personnel follow strict hygiene and aseptic technique requirements. This is the first line of defense to prevent microbial contamination of compounded sterile products and to minimize the introduction of particulate matter into compounding areas. Your self-assessment should include no cosmetics, no jewelry on your head, hands, and wrists. You should only wear hospital-issued scrubs. You cannot have a respiratory infection or a fever, any open sores, flaking skin, or sunburns. And finally, no artificial nails, including gel nails, and fingernail polish is allowed of any kind. Based on new USP 797 guidelines, the garbing sequence is no longer specified and will be left up to each facility to decide. Our department will follow this sequence: bouffant cap, mask, and then shoe covers one at a time as you step over the line of demarcation. Watch as this sequence is demonstrated for you. Place your bouffant cap over your head, completely covering your ears, and ensure that all hair is tucked inside. There are two types of masks to choose from in our clean room. The first one is the mask you see here, which is a fog-free surgical mask, helping to reduce the problem of eyeglasses fogging up. The second mask of your choice is a yellow procedure mask. Either one is approved for use in the sterile clean room setting, and they are both latex-free. Next, choose the correct size of gloves, place them on the cart, gather your shoe covers, and have a seat on the bench. Don the first shoe cover, ensuring that your entire shoe is covered as much as possible. Then step over the line of demarcation. Repeat this process for the other shoe, only stepping over the line of demarcation once the shoe cover is on completely. It is important to note that each time you cross the line of demarcation from dirty to clean, you must don a clean pair of shoe covers. Once over the line of demarcation, obtain a clean room approved gown and open the outer packaging only and place the gown on the counter. Repeat this same procedure for opening up your sterile gloves. Checking the package for integrity, place the inside sterile contents on the counter. Hand washing is one of the most important steps to ensuring that introduction of microbes that may compromise any preparations made by the employee and potentially harm the patient are prevented. Under warm water, clean under fingernails to remove debris thoroughly. Next, rinse your hands and your arms all the way up to your elbow with warm water and apply several pumps of antimicrobial hand soap approved for the clean room. Working from the fingertips to the elbows, wash your hands vigorously for a minimum of 30 seconds. Be conscious to wash every surface of every finger and always commit to being thorough with each hand wash. And finally, rinse thoroughly, starting with the fingertips and ending at the elbows. Dry your hands using a lint-free, clean room approved wipe. Always dry, starting with your fingertips and moving toward your elbow, patting your skin rather than wiping it to decrease the sloughing of dead skin cells. You are now ready to don your cleanroom gown. Unwrap the gown from the outer wrapping, unfold it completely, and don the gown as shown from the front. Secure the Velcro firmly behind your neck. Tie the inner ties first. Remove the tie holder and tie the outer ties. Ensure the back of the gown is closed as much as possible. Dispense 1 pump of Avogard, a cleanroom-approved hand antiseptic, into the palm of one hand and rub hands together vigorously, applying to all aspects of both hands. Allow to dry completely without using towels or cloths of any kind. Open the sterile package and fold it towards the bottom so as to unfold the paper and keep it open. Glove your dominant hand first. Using the thumb and index finger of one hand, carefully grasp the folded cuff edge of the glove. Slip the other hand into the glove in a single movement, keeping the folded cuff at the wrist level. Pick up the second glove by sliding the fingers of the gloved hand underneath the cuff of the glove. In a single movement, slip the second glove onto the ungloved hand. Ensure both gloves are pulled completely over the cuffs of the gown.